Hello, everybody, and thank you for joining us this morning for this important webinar that will talk about Medicare and give an overview of Medicare Parts A, B, C, and D, and some important updates for this new year in 2021. And wanted to introduce my colleague, Kristen Burke, who will be making the presentation this morning. Kristen is our National Marketing Coordinator with many years of experience in the brokerage industry as a Medicare specialist and former sales director with many of the carriers as well, like Mutual of Omaha and Medico. And we're very lucky to have her as part of our team here now with us for over 3 years. So before the presentation does begin, I will let you know that you can ask any questions in the GoToWebinar control panel that you see there. Make sure that you ask a question in the chat feature or the questions feature there. You can ask a question and we'll be sure to address those questions at the conclusion of the webinar. So with that, I want to turn it over to Kristen. So Kristen, thank you so much.
Thank you, Rob, and good morning or good afternoon to everyone that's on the call, and greatly appreciate you guys taking the time out of your day. It's off to a busy start here in 2021. We're all, I think, very optimistic that 2021 will be a better year since over 2020. So, and you know, this may be an overview or review process for some of you that you're currently in the Medicare market. It's always good to get some updates of what's going on in the market. There's new figures and numbers, deductibles, whatnot, that we will definitely cover. If you are brand new to Medicare, we welcome you. This is a huge opportunity. It has been for many years for agents in selling insurance in general. I strongly feel the importance of working with your clients as they make this transition into Medicare. You may think that it's quite complicated. We will try and simplify that for you. And really, once you kind of get the nuts and bolts down, it's a pretty straightforward process. And so it takes just a little bit of learning to understand Medicare and how that works, the components of it. But then it's really a commodity, type transactions. And so if you're working with your clients for life insurance, annuities, long-term care, DI, it's just a natural fit to help them make this transition as they age into Medicare. So hopefully you'll find this information helpful. And we here at Art General Company have tons of experience in the senior market, helping agents with Medicare, answering questions, finding the right plans. So feel free to always contact us and let us know how we can help you and help your clients. So that's a key factor. So we'll get into this, and as Rob mentioned, definitely type in some questions as you think of them, and we will address them at the very end. So looking at, and stepping back here, looking at Medicare, just in a general sense, it was established in 1965. It is a social insurance program, and it provides health coverage to more than 59 million individuals in our country. So huge population. You may wonder who's eligible for Medicare. Well, first off, there's a small segment of that population that are eligible for Medicare, and that's for the folks that are under age 65. And it's only a little segment of that. It's the people who are disabled and they have been receiving disability benefits from Social Security for 24 months or longer, and then they are automatically enrolled in the Part A and the Part B of Medicare. Also, another segment is folks that have ALS or Lou Gehrig's disease. If they happen to have that disease, they are automatically enrolled in Part A and Part B the month Social Security disability benefits begin. But the largest, as well as then individuals have permanent kidney failure. The largest population of individuals that you would be working with are the individuals that are simply just, we call it aging into Medicare. So they are 65 and older. we've seen a huge boom. You probably have heard of baby boomers. So that's that population that are all turning 65, and nearly 10,000 or more individuals are turning 65 each and every day, and they need help from agents like yourself. So, but that's who you would work with. Occasionally, you would probably work with those folks that are in the under age 65 market, and we can definitely assist with those types of situations too. So you may wonder, what exactly makes up Medicare? Well, the portion that started in 1965 is that traditional Medicare, and you'll see in the graph here on the left-hand side. What makes up traditional Medicare? Well, there's the Part A of Medicare, which is hospital insurance. And then there's the Part B, which is the medical insurance, otherwise known as maybe doctor services. So those two, traditional Medicare, Part A and Part B, was established in 1965. Part C came up a few times since then. So probably like in the late 90s, 2000, but they've really had a strong presence, the Part C Medicare Advantage plans in the marketplace today. And we'll get into more details about all of this in the next few slides. The last segment is the Part D, the prescription drug coverage. So that also came about in the early 2000s as well. So we'll kind of go into more details on that as well. So looking at the Part A of Medicare, Part A is going to be premium free when a beneficiary or their spouse had 10 years or more of Medicare covered employment. So that's the majority of the folks that you're going to be working with. Now, occasionally you may run into someone who does not meet that requirement of 10 years of Medicare covered employment. If they have not worked, and if you will, worked in the system, paid into Medicare for at least 10 years or longer, then they can still pick up Part A. They would just have to pay a premium for that. If someone is receiving Social Security retirement income, they are automatically enrolled in the Part A at the age of 65. So what makes up Part A coverage? So as I mentioned, it is hospital, really kind of centered around hospital care, skilled nursing, hospice, and blood. So and there's always that misconception too. I know my parents have neighbors that said, you know, I've worked hard and paid into Medicare for many, many years. When I turn 65, I'm just going to have Part A and Part B of Medicare because it's going to cover everything. Well, that's not always the case. So as you can see here, there are a number of out-of-pocket expenses that one will incur if they happen to need care and they simply have Part A of Medicare. As you'll see here, at the time in which they are hospitalized, they would need to meet a deductible. These figures, as I'm going to go through here, do change each year. So these figures are as of 2021. So an out-of-pocket expense deductible, they would need to pay of $1,484. So Medicare is going to cover the first 60 days if they are in the hospital. But on that 61st day to the 90th day, that individual will also then have to start paying $371 per day. On their 91st day to the 150th day, that individual would have to pay out $742 per day. After that 150th day, all costs would be the expense of that client. So Medicare will stop paying anything after that point in time. Then looking at the skilled nursing care. So Medicare is going to cover our first 20 days of skilled nursing. On the 21st day to the 100th day, that individual will have to start paying out of pocket of $185.50 per day. If they're still receiving skilled care nursing on the 100th day or beyond, then that individual is going to have to start paying all expenses for that skilled nursing care. Hospice, there is a copay of $5 per outpatient prescription drug and a 5% of the Medicare approved amount for the inpatient respite care. Also, the individual is responsible for paying for the first 3 pints of blood. Now, there's not a figure that we can readily give to you, as that the cost for blood does vary by state. So, but we can try and track that down if that is a question that does come up. So that's the expenses and the out-of-pocket costs that pertain to the Part A of Medicare. Now I'm looking at the Part B of Medicare. Again, this is kind of doctor visits, situations like that. So there is a monthly premium that they would need to pay for the Part B and that figure always changes as well. So this year, the Part B monthly premium is $148.50. I'm going to show you on this next slide that this is the standard, that $148.50 is going to be the standard premium that one would have to pay. However, if someone is a higher income earner, then that premium may be actually greater than the $148.50, and I'll show that to you in just a minute. Also, there may incur a late penalty if they don't sign up right away, so to also keep that in mind. So here's that chart that I was just referring to. So if you look at what their filed individual or joint tax returns from 2 years ago will then determine what their Part B premium would be. So they need to look at their 2019 tax return, and then they will then dictate then what premium would be for their 2021 plan. And we can give you all of this information. We'll send out the PowerPoint presentation to you at the end, so you don't need to be frantically writing this down or taking pictures with your phone. We'll have this to you. What does the Part B of Medicare cover? As I mentioned earlier, so is doctor services, outpatient care, preventative services, diagnostic tests, some therapies, and durable medical equipment. There are some out-of-pocket costs associated with the Part B as well. There's an annual deductible that always fluctuates as well. And I say fluctuate because sometimes it goes up, sometimes it goes down. So this year for 2021, it is $203. After that deductible has been satisfied, there could be a 20% coinsurance for most services. So again, as we just walked through, someone that just has Part A and Part B of Medicare, and they think that Medicare is going to cover everything, as you can clearly see, there is some out-of-pocket expenses that a senior needs to be aware of when they are turning 65 and getting into Medicare. As we mentioned, there's Medicare Advantage plans. So these are also called the Part C of Medicare, and it must cover what Medicare covers. So in a sense, it's replacing original Medicare, but that individual will still have to pay the Part B premium. Now, what's really nice with Medicare Advantage plans is either a zero or little premium that they would have to pay out on a monthly basis. However, they need to be aware of the maximum out-of-pocket costs. So if they happen to be hospitalized or need some care, there's going to be some out-of-pocket costs associated with this Medicare Advantage plan. So that does definitely vary from plan to plan. They can only enroll in a Medicare Advantage plan at certain times or switch at certain times of the year. And we'll get into more details about the enrollment election periods later on. But typically, if someone picks up a Medicare Advantage plan, they've had that plan, normally then it's effective the first day of January of that year. They have that plan for that year. Then they have a we call it AEP, or the annual enrollment period, where they can either enroll in another plan, switch other plans, and that's only during that AEP time period, which many of you might have heard that just in the industry, and it runs from October 15th to December 7th. So it's a very busy time for agents that are working in the Medicare market. Another factor that you need to be aware of, and the clients as well, is with Medicare Advantage plans, it is all network-based plans. So you need to make sure that your hospital, your doctors are all a part of the network that the carrier has established. So you don't want to have any surprises after getting into a Medicare Advantage plan and then realize that your doctor that you've seen for years is not a part of the network. So they're either a HMO or a PPO plan. As I mentioned, Medicare Advantage has rolled into the market, and they've really, we've seen a huge rise in the individuals that are rolling into Medicare Advantage plans. So as of 2019, 22 million have enrolled in a Medicare Advantage plan. So that makes up about 35% of the Medicare beneficiaries. There are some value add benefits that Medicare Advantage carriers do add to their plans. So there's a ride share with Uber, gym memberships, wearable devices that monitor health. The real key with these Medicare Advantage carriers is that they want to make sure that their seniors are staying active and healthy. It's a win-win for everyone. So the industry does expect for or predicts that the number of enrollments for Medicare Advantage plans are going to increase up to 47% by 2025, and eventually up to as high as 70% in the future. So definitely continuing to see a lot of growth in the Medicare Advantage market. As I mentioned, it is an alternative to original Medicare. So as I briefly mentioned a few slides back, there are various different Medicare enrollment periods that an agent as well as a client needs to be aware of. And I just want to take a side note and mention that all of this information is out on medicare.gov. So you can always go out there and pull all of this information pertaining to Medicare, traditional Medicare, Medicare Advantage, Medicare Supplements, prescription drug plans. All of it is right there, and it's updated constantly on medicare.gov. There's a guide called the Guide to Health Insurance. That's another great booklet, and it's actually required to be given to clients. So Guide to Health Insurance, it really helps explain how Medicare and all these plans work and all these various different enrollment periods too. And then there's the Medicare and You booklet that you can also refer to as well. So when you're looking at the Medicare enrollment periods, the initial election period for Medicare is 3 months before the month of their 65th birthday, the month of the 65th birthday, and up to 3 months after the month in which they turn 65. So this pertains to the Part A, Part B, Part C, which is Medicare Advantage, and Part D, which is the prescription drug plans. There's also a general enrollment period that lasts from January 1st to March 31st, and that would give the client an effective date of July 1st. So again, this is, we're actually right now in the general enrollment period. As I mentioned earlier, there's the annual enrollment period, or otherwise known as AEP, and that is from October 15th to December 7th. That's really centered around Medicare Advantage clients and individuals that are on prescription drug plans. But if you have a client that's on a Medicare Supplement plan, which we'll talk about Medicare Supplement plans here in a few slides, but Medicare Supplement plans really kind of help fill the gaps in original Medicare. During this annual enrollment period, even clients that are on a Medicare Supplement plan, they've just grown accustomed to, this is my time to review my Medicare Supplement plan. They might not be on a Medicare Advantage plan, they're on a Medicare Supplement. So it's just turned into, a Medicare awareness timeframe is this annual enrollment period. So that's why it is so busy. There's just so much activity from October 15th to December 7th. There's also the special election period. So if one would lose their employer group plan, then that gives them 60 days from the date coverage terminates for them to have their SEP, or their special election period. And there's also various different other scenarios that one would qualify for an SEP as well. And you can find all that information again on medicare.gov, or we would be happy to help you here at Art Jetter & Company. Also, Medicare Advantage has an open enrollment period, and we're in that period right now. So that is January 1st to March 31st. So this open enrollment period for Medicare Advantage gives these members the opportunity to switch maybe Medicare Advantage plans. Maybe they enrolled in one during that AEP time period, and now they're in this plan and they realize, you know what, my doctor's not on that Medicare Advantage network that I originally wanted. So I want to switch to another plan, another Medicare Advantage plan. So that gives them that opportunity, January 1st to March 31st. Also, they may be able to switch back into original Medicare as well. So keep that in mind when you're working with Medicare Advantage clients. There is this open enrollment period that's going on right now. Next is the Part D, the prescription drug plans. So these are offered by private insurance companies, and there is a premium associated with these drug plans. They are tiered drug plans with copays. You can either have it as a standalone prescription drug plan, or some Medicare Advantage plans, or a lot of them, offer a prescription drug benefit and plan within their Medicare Advantage plan as well. There's also a late penalty if you enroll, a late enrollment penalty for the prescription drug plans as well. So you want to make sure that your clients, when they're turning 65, that their plan, whatever plan they go with, they need to have some drug coverage in there. If it's a standalone or if it's a prescription drug plan that's tied in with their Medicare Advantage plan. So that's definitely a key factor. Now, many of you are aware of health savings accounts. I was just actually looking at mine over the weekend, and but some key facts that you need to be aware of when you're working with clients that are getting into Medicare, and they may have been contributing into a health savings account. So your client needs to make sure that they stop all contributions into their HSA up to 6 months before you start collecting Social Security. So that's a key factor. HSA is a tax-exempt medical savings account. So those with a high deductible health plan can fund, pay for qualified medical expenses. You can continue to take withdrawals out of your HSA plan that would help pay for any type of medical expenses, but you cannot make continued contributions into your HSA plan. So if you use the account for qualified medical expenses, it would be continue to be tax-free. So if you do not take Medicare right away, you need to take into consideration when you're going to start collecting the Social Security benefits and when you've contributed last into your health savings account. So that's a key factor to keep in mind when you're working with clients that are turning 65, getting into Medicare, and have a health savings account. As I mentioned a few slides back, there's also Medicare Supplement plans. So Medicare Supplement plans really fills the gap in Medicare. You may have heard the term Medigap insurance too. So what it does, it's going to pick up all those deductibles, coinsurance, and copays that we went through, those figures that are associated with the Part A and the Part B of Medicare. And as I also mentioned, with the Part A and the Part B of Medicare, those deductibles, coinsurance, copays increase, or they change each year. Medicare Supplement plans will cover those new expenses each and every year, so no worry about that. Medicare covers less than half of the beneficiary's total costs. So that's why having a Medicare Supplement plan, in addition to traditional Medicare, is a key factor, just so that there's no surprises on those deductibles and copays. Medicare Supplement plans are guaranteed renewable. And the nice thing about Medicare Supplement plans is that you can see any provider that accepts Medicare. No referrals are needed. And most doctors, if not, I would say, I don't know the exact percentage, but a large amount of physicians and doctors and hospitals do accept Medicare. If your clients plan to travel, this is another key factor. Medicare Supplement plans, if they are traveling across the country, or maybe they have a second home in a warm location, then Medicare Supplements is a good fit for them, because then they can go to any doctor or hospital in that other location outside of their resident state. So Medicare Supplement plans have more flexibility, I would say, than a Medicare Advantage plan. Medicare Supplement plans are sold by private insurance companies. Medicare Supplement plans are standardized, meaning that a plan, all the plans are identical. And so really it makes it easy for individuals to compare. And really the only thing that you're looking at is the costs. And maybe, based on where one lives, by the various different plans, by the various different carriers. So those factors come into play, but explaining what the various different Medicare supplement plans are will be identical across the board. So these are heavily rated by the federal as well as at the state level, so that there's a lot of control on that, and everything has to get approved before an insurance company rolls out a Medicare supplement plan. So it's definitely heavily regulated. A client can only have one Medicare supplement plan in force at a given point in time. Now, they may be able to switch from one Medicare supplement plan to another. They'd have to go through underwriting, which we'll get into that as well, but they can only have one in force at a given point in time. Now, Medicare supplement plans have been really on the market right after Medicare began. I believe 1966 was when Medicare supplement plans were first rolled out. So they've been around for a very long time. Now, they've kind of changed over the years as they've made some enhancements. The last one that went into effect is the Medicare Access and CHIP Reauthorization Act of 2015, or better known as the Doctor Fix. This went into effect January 1st of 2020, so just over a year ago. Medicare supplement plans are no longer able to pay that Part B deductible, and we'll get into that in just a moment. So if you have a client that is just turning 65 this year or just getting into Medicare, anytime after January 1st of 2020, if they are just getting into Medicare, just turning 65, they will no longer have access to plans C and F for Medicare supplement plans. So anyone that was 65 or on Medicare prior to January 1st of 2020, they will still be able to purchase a Plan C and a Plan F. So let me just show you this chart, and this kind of will help explain it a little bit further. So you can see here in the darker shade columns in the very center, it lists out A, B, D, G, K, L, M, and N. So those are the plans that are really available to anyone that is on Medicare. However, those are the only plans that I just listed out that are available to individuals that got on Medicare and turned 65 after January 1st of 2020. Now, let's say for an example, my mom, she's been on a Medicare supplement plan for quite a few years. So she turned 65 years ago. Because she was eligible on Medicare and over the age of 65 prior to January 1st of 2020, she can still have access to plans C and F. So for an example, she is currently on a G plan. If she wants to switch to an F plan, she can do that. She would just have to go through the underwriting process. However, if you're working with somebody that turned 65 last year in 2020, they would not have access to plans C or F. So it's a little confusing. They kind of grandfathered a segment of the Medicare market and in different pools, if you will. So the most popular plan today is the Plan G. And as you can see with all the check marks, it has the most when you compare it to different carriers or to different plans. So the only thing that the Plan G does not cover is that Part B deductible. And as you can see here, all the plans listed, they do not cover that Part B deductible. However, C and F do, but again, that's for those individuals that were eligible for Medicare and turned 65 prior to January 1st of 2020. But where we're seeing the majority of the business is on that Plan G. Plan N is another plan that is gaining quite a bit of popularity. We're seeing an increase in Plan N sales over the years. And the only difference between the Plan G and the Plan N, there are some copays for the Part B, but then Plan N does not cover the Part B excess charge, where Plan G does. So when you are talking and working with an insurance company, It depends on the state, but we can help guide you with this. But an insurance company can really determine what of these plans they want to offer to seniors in a given state. So we can help you, and we'll show you, each outline of coverage, they call it, or rate book, that carrier has for each state. And then it's really, looking at the pricing is then broken down by the various different zip codes, the different plans, and then tobacco, non-tobacco, or gender. So you'll then see within these guides, it will also lay out what these plans will cover, what Medicare covers, and then what the client is responsible for after Medicare and a Medicare supplement would pay. So it kind of really lays that out nicely. So, it helps explain all of that while you're meeting with your client. So Medicare supplement plans, they cover, the basic benefits. That Part A coinsurance for inpatient hospital care, cost of 365 extra days of inpatient hospital care. It's going to cover that Part A hospice that we mentioned earlier, the Part B coinsurance after the deductible, as well as the first 3 pints of blood each year. Now, with my insurance carrier background, I jokingly would say to the actuaries, this is where they can be creative, if you will, because if actuaries can be creative, that's just a joke. But this is where an insurance company can really dive in and see if all the plans are identical from carrier to carrier, how can we as an insurance company stand out in the market? Well, they can have different gender rates, male, female, unisex, tobacco, non-tobacco. They can look at area rating, maybe looking at urban versus rural, different pockets of a state, and really hone in and price their plans accordingly. They may even offer household discounts or spousal discounts. And those definitely do vary. We're seeing anywhere from a 5% all the way up to a potential of 15% household discounts. So depending on the insurance company. And then the risk, you're looking at, how much are they, how much is on their book of business, and things like that. If you are not used to working with different lines of business, maybe you're working in a life insurance market where you are not used to seeing rate adjustments. So just be aware and know that with Medicare supplement plans, it is common and it is a must for insurance companies to take rate adjustments. And they will take rate adjustments anywhere from 12 to 15 months, maybe 18 months max. But it is very common that they do take rate adjustments. So don't be alarmed by that. And the reason they do is to help keep with the rising costs of Medicare trends, all those claim trends, as well as those changes with the annual deductibles and copays that they are covering. So it is very common for rate adjustments to occur in the Medicare supplement space. There's different ways in which a client can apply or qualify for Medicare supplement plans. So I'll walk through, there's really like 3 different situations that you really need to, evaluate when you're talking with your client. First, and probably the most popular and probably the easiest, is open enrollment. So when you're talking with your clients, they're 64, you know that their open enrollment window is approaching because it lasts for 6 months and it starts on the first day of the month in which that person is enrolled in the Part B of Medicare and is 65. That's where you're going to see a lot of these clients who opt to go into a Medicare supplement plan. They pick up the Part A of Medicare, the Part B of Medicare, and that's effective the first day of the month in which they turn 65. And then they'll pick up a Medicare supplement plan the first day of the month in which they turn 65 as well. So this is the easiest way to sign clients up for Medicare supplement plans because during this time period, an insurance company cannot deny a person any Medicare supplement policy it sells. So again, whatever they're offering in that state, they need to be able to offer that to that client. They can't make a person wait for coverage to start. They can't charge a person more because of their health problems. No health questions are asked. Now, they may ask a tobacco question, but nothing else would be asked from a health standpoint. They don't need to see their pharmaceutical medications that they're taking. There's no health interview, nothing. You're simply signing them up for coverage. So that's the first, enrollment opportunity that you can work with your clients is called open enrollment. Another scenario would be guarantee issue. Now, there's no underwriting, no health questions if someone falls in a guarantee issue, right opportunity. So, but there's just various different scenarios that one has to be in order for them to be in a guarantee issue situation. Again, if they lose their group coverage, then that would be a situation where that client is in a guarantee issue situation and they can enroll into a Medicare Supplement plan without any health questions. There is lower commissions with guarantee issue business, but there's all these scenarios that are listed out there. We can show them to you just so that you're aware of them. And if talking with your clients, definitely just let us know, and we can say, well, no, this client's in open enrollment, or no, they're in a guarantee issue situation. So we can help determine what situation they are in based on their circumstances. So if they're not in open enrollment and they're not in guarantee issue, well, then they have to go through underwriting. So, and then most of the time that you'll see someone that is having to go through underwriting is if they're wanting to change. Maybe they're 70 years old and they've been on a Medicare supplement plan for a number of years, maybe a plan F, let's say, and now they want to switch to a plan G. They would need to go through the underwriting process to see if they would qualify for coverage. So they have to answer the health questions on the application, height and weight. They would list out their medications, and sometimes they do random health interviews as well. And then some carriers look at pre-existing conditions too. So, but it's really straightforward. The questions are right there on the application. All these carriers that we work with, I can't even, 15 or more different carriers, but they also have the height weight charts, the build charts, so that you can review that when you're talking with your client. You can also look at and ask your client what medications they're taking, because these carriers typically have a list of medications that they would not consider health issues, things like that. So I also want to note, when we're going through the underwriting process, and you're not quite certain if this person would qualify for a Medicare supplement plan, we have an in-house underwriter here at Arch Company that can help you determine if they would qualify for health for a Medicare supplement plan or not. So again, we can help you with all this as you discover, their medications, their health situation that they're currently in. As I mentioned earlier, individuals may be eligible for Medicare if they're under age 65, if they have, they are disabled, they have Lou Gehrig's disease, permanent kidney failure. So there's certain states that do require Medicare supplement insurance companies to offer Medicare supplement plans to those individuals that are under age 65. That is controlled at the state level. It's not at the federal level. So it's dictated by state. So they need to at least be receiving Social Security disability payments for 24 months and automatically enrolled in the Part A and Part B. And then that individual would be able to enroll in a Medicare supplement plan that is offered to underage individuals in that state. And like I said, not every state does offer Medicare supplement plans to that underage market, but some do. So we can also help decipher that as well if you run into one of these situations. Keep in mind as well, once that individual turns 65, they are entitled to a new 6-month open enrollment period. So they can then switch into another Medicare supplement plan when they're turning 65 without having to go through health questions. So that's a key factor to keep in mind. Medicare supplement plans for the underage market is going to be quite expensive. I mean, I hate to say it, and I feel for these people, but it's an automatic claim. So it's a great opportunity that they are able to switch into another Medicare supplement plan when they turn 65, and then their premiums will come down. But again, we can help you with all of that. So as I mentioned, we work with a ton of Medicare supplement carriers. Where do they stand out in the market? If all the plans are identical, who do I go with? And we'll help you determine that. Looking at their premiums, What's the cost of these plans? What plans are being offered in your state or area or states that you work in or where your client resides? What's the experience that you yourself and your customer are going to receive from a service standpoint when working with that company? Also, the brand name. Do you need to explain who that insurance company is? Or do you know that name? Does your client know that name? So those are key factors, as well as value added benefits and discounts. So there are, even though all the plans are identical across all Medicare supplement insurance companies, there's ways in which carriers do stand out. And we can really help show you those plans and give you and your clients options to see what is the best fit for your clients. So here's the closing slide. I just wanted to let you know, we here at Art Jetter & Company are here to help. You can contact us by 800-228-0008. Ask for anyone that's on a senior health team that can assist you with anything that you need. You can always send us an email at seniorhealth@jetter.com. Check out our website if you haven't seen that. We do have a new website, jetter.com as well. Tons of information out there that very helpful. Help with quoting if you need some quoting software for Medicare supplement plans and various other senior products. So we can help you with Medicare supplements, Medicare Advantage, prescription drug plans, understanding just Medicare in a general sense. So we're here to help. Not only are we in the senior market, we're also, we offer annuities, cancer, critical illness, dental, DI, final expense, group coverage, health, life, long-term care, linked, Medicare, again, short-term care and work site. So we really can help you. We're a one-stop shop. We can help you with all of your insurance needs. We've been in business since 1979. We offer free E&O. We have case managers will help you with all of the business that you're writing. As I mentioned, we have an underwriter. We can help with leads. So many opportunities to work with us. So if you're brand new to Art Jetter & Company, definitely give us a call, and we are here to help you. We do always answer the phone, but again, tons of training is always available to you. And I think that's really much the end of it. So I'm going to look to see if there's any questions at this point in time. I'm going to turn it back over to Rob, and he's going to talk about another amazing tool and opportunity that we are providing to you as being an agent with Art Jetter & Company.
Kristen, thanks so much. It was a great presentation, very informative, and it's always good to get the updates for the new year and provide an overview of Medicare, because it's an ever-growing and continuously tremendous opportunity to help your clients and even your loved ones, help them reduce their medical expenses in their retirement years. Medicare has a notion or a stereotype, I guess, that it's confusing, but we're really here to help agents and brokers, really simplify it and help their clients, guiding them through that process. To help guide our agents through that process, we are very, very excited about a brand new tool that we will make available, that we are making available to our appointed and certified producers and agents. We have partnered with a company called Trustee Care, and they have a tremendous new tool. Trustee Select Pro is our new all-in-one Medicare quote and enrollment tool that allows you to quote and enroll all Medicare plans, the Medicare Advantage plans, the Medicare Supplements, and the prescription drug plans, quoting and enrolling those plans for your clients, all from one platform, one login. And we have opened it up to all the carriers in your market, regardless of whether you're appointed with them or we're appointed with them. We want you to be able to provide your clients with be fully transparent, letting them know what plans are going to provide them with the most savings. And then you can also customize it, though. You can also customize the tool to show the carriers that you have and that are providing just as much savings as the plans that cost as the most cost-effective plans. So one of the main highlights of the tool, and we're going to have more demonstrations on this in the coming weeks and months ahead, but one of the main features of the tool, I call it my aha moment that I had when I first saw it, was that so imagine it's September, you're really busy, you're faced with a daunting task of having to update all your clients' prescription drug plans and their list of their medications to make sure that they are enrolled in the most cost-effective prescription drug plan for the upcoming Medicare enrollment period. And you have hundreds of clients, 100 clients or 50 clients that you have in your book of business, and you know that they're counting on you to make sure that they have the most cost-effective plan. But you have to go through a daunting task each year of updating their drugs, and so this tool helps take that grunt work out of the process for you. We want to be able to give our producers access to this as soon as possible, so that you can use the tool now to input all of your clients' data. You input their name, their email address, there's some of their demographics. You put in their as much information as you know about them, like their drugs, their primary care physician. And then once they're inputted into the system, and you do this throughout the year, come September, you have a list of all of your clients ready to go. And then with just a click of one button, you can send a customized, personalized email to all of your clients, or you can select however many you want to send it to. And with this personalized email, it asks them to update their prescription drug medication and any new information that impacts their Medicare coverage, like their primary care physicians. The tool also asks consumers and the clients, it gives them the option to grant you, the agent, to have access to their MyMedicare.gov account. So as we've seen in the past, 2 years ago when Medicare.gov, took away the ability for brokers to save the prescription drug information year over year. That was a tremendous benefit when it was available through Medicare.gov, which is no longer available. So right now with this tool, it saves the prescription drug information year over year, and you're then notified as to when your clients have updated their information. And once they've updated their information, the system then generates a plan that is going to be the most cost effective. And we saw a demonstration where, so those who, the developers showed the demonstration, and so the system generates a recommended plan that's most cost effective, and then they went and did it manually as well. And in each, I think we saw 6 or 7 different scenarios, and in each scenario, the one that the developers did manually matched the one that the system generated. So that is just incredible, and we're very, very excited to be able to offer this to our producers, who are appointed and certified with us, or perhaps are just selling Medicare supplements. It's good for Medicare supplements too. That doesn't require any certification, but we're glad to be able to offer this to our producers. And you're certainly welcome to email us at seniorhealth@jetter.com or give us a call at 800-228-0008, and certainly ask and inquire about any further information. But so we certainly will open it up for any questions. If anybody has any questions, just feel free to let us know.
Great. There is a question that came in, and it's asking, if a client has an SEP because of a loss of employer group coverage and they enroll 30 days after loss of coverage, when would their Medicare coverage be effective? My understanding, and correct me if I'm wrong, Rob is an extreme expert in this market as well. It would be the day after they sign the Medicare supplement application. That is the soonest in which they could have the effective.
Yes, that's true. It can be made any day after the act is effective up until 30 days after. So in that scenario, the SEP would end 60 days or 63 days actually after they've lost their credible coverage. So
another question, and I've been answering some of these here. So the question came, so doctors will accept Medicare supplement plans, is that correct? And yes, I mean, there may be a doctor out there or hospital that stops accepting Medicare. Some specialists don't accept Medicare, but in most case scenarios, they will accept Medicare. And Rob, you can always chime in if there's anything else you want to add.
no, sure, no, that's correct. I've seen only maybe a handful of cases or scenarios where a provider has not stopped taking Medicare, but it's very, very rare.
Yes. Also, can you switch from a Medicare Advantage plan to a Plan G without evidence of insurability? If you want to switch from a Medicare Advantage plan to a Medicare Supplement plan, you need to show insurability where you're coming from, that you did have credible coverage, and then that with Medicare Advantage plans, how that came to be is it's really, the thought is Medicare Advantage plans is going to try and help alleviate the stress and strain that original Medicare, traditional Medicare has because of all of the baby boomers. So in a sense, it's an alternative to original Medicare. So if one would pick up a Medicare Advantage plan, they have that plan, it's the very first plan that they're on, and it's within the first 12 months of them being on that Medicare Advantage plan, and they decide they want to switch back or switch to a Med Sup, then they can switch without going through the underwriting process.
Correct. If it's past that 1 year, then it's going to require underwriting.
Correct. Yep.
I'd like to add one final point for for any producers out there that do business in Colorado. The state of Colorado is the only state in the country that has issued a special election period that began January 1st and goes to the end of June through June 30th, that allows Medicare supplement policyholders who have Plan F to go to Plan G without any underwriting. If they have Plan C, they can go to Plan D without underwriting, or if they have Plan High Deductible F, they can go to High Deductible G without any underwriting, and that's from January 1st through June 30th that they can do that.
Okay. I know, Scott, you were asking about where to be able to quote clients, plug in their current drug plans, and then figure out maybe potentially new or different PDP drug plans. So, and that's the tool that Rob was just talking about, trustee.care. It is not on jetter.com. So what I recommend is call into our office, and if you're currently working with one of the marketers here in the office, any of them can help you talk to you about trustee.care, because this tool can do that for you. So you can really plug in their information. If they're using the Medicare Blue button, then you can plug that information in, and it's a great tool to be able to compare very quickly all the plans that are out there in your area. I think I see one more question. So dental, a question about how dental plans work and why would one sell a dental plan to a senior? So most of us that are employed, in our working years, we have dental insurance through our employer. And when we then retire, we no longer have dental insurance. So there has been the need for seniors, because they do require more dental work than in your younger years, for seniors to receive and have a dental plan. They are standalone dental plans, and there would be, waiting periods, deductibles, and the plans pay so much for maybe major services, things like that. We can get you a lot of information in regards to the various different dental plans that carriers offer. But there's no coverage within a Medicare Supplement plan for dental or for tied in with a Medicare Advantage plan. So I had heard a while back that supposedly there was a bill that was trying to get passed, that they were going to try and tack into Medicare, and it was called something like seniors have eyes, ears, and teeth too. So basically providing some sort of dental, vision, and hearing coverage within original Medicare. I haven't seen anything come about of that, but in the meantime, though, we do work with tons of different carriers that offer dental insurance. There's no underwriting. They sign up. They just have waiting periods for that, and we can get you all that information. Okay, so the last question I see here: how do we know if we're offering the best plan? What would you look for when selling a Medicare Advantage plan to a client? I'm just getting my feet wet. Rob, I don't know if you want to tackle this one.
Sure. I guess there's certain buzzwords in the industry that, from a compliance standpoint, that we're all trained on that, that are, make us raise our eyebrows, and that's one of the words is best. So it really, when you're selling a Medicare Advantage plan, you want to be sure of, the first most important thing is network, that your clients are okay with the plan's network, and that the doctors, their primary care physician, is in that plan's network. If they have an HMO plan, especially because HMO plans are plans that are network-based plans and are very limited on out-of-network benefits. You have to pay more if you go out-of-network, and sometimes if you go out-of-network, that doesn't go towards the maximum out-of-pocket unless there's designated a maximum out-of-pocket for out-of-network. There's also HMO, and now if they have a point of service option on the HMO, that has more out-of-network opportunities. Obviously, with a PPO plan, a preferred provider organization that has in and out-of-network capabilities and benefits. In addition to the network, you also want to be sure that take a inventory of all your clients' prescription drugs, and making sure that the plans that you are considering enrolling them in cover your clients' drugs. Sometimes there can be estimates and that vary greatly. Thousands of dollars. At the end of every AEP, you always see if you follow some of the Medicare on social media, or LinkedIn, brokers and high producers out there are sharing that their Medicare plan that they enrolled their client in this year saved them, thousands and thousands of dollars, and they do a comparison, because formularies change. And so the three main things to look for when selling a Medicare Advantage plan, again, are networks, primary care physicians, and making sure that your client's prescription drugs are all accounted for in the plan that you're offering to your client.
And then with, I know that there's some plans that offer a dental discount program. Rob, are there Medicare Advantage plan carriers that offer dental coverage truly?
Yes. So Medicare Advantage plans will include most carriers now you can add dental coverage. And this question just came up this week when a producer asked if if they have to pay additional for the dental. Yes, most of the carriers you'll have to pay. I've seen it, between $35, $40 a month for the dental coverage to add on a dental plan to the Medicare Advantage plan. But most carriers do offer that, or they may have a dental discount card that would be at no additional cost, but that would be just a discount card, not a insurance. Also, with Medicare Supplement plans, a lot of the carriers will have a dental discount program as a value-added benefit to provide a discount for dental services. And with Medicare Advantage plans, as was discussed in the presentation, that they're zero to little premium, but in exchange for that, you pay high out-of-pocket costs. And with the high out-of-pocket costs this year, the out-of-pocket costs, the maximum was raised this year to, I think, $7,200 or $7,500 is the most that a Medicare Advantage plan can have as a maximum out-of-pocket cost. I've seen very few that have gone that high, but they can be anywhere from $3,400 to up to $7,500 now. And but to help with those out-of-pocket costs, there are some of our carriers that have hospital indemnity plans, and that's if you're going to be offering your client a Medicare Advantage plan that has those high out-of-pocket costs and exposure, it's almost a necessity to present to your clients that the money that you're saving on not paying any premium for your Medicare Advantage plan, put that towards a hospital indemnity that can be a bare hospital indemnity plan that is really inexpensive, maybe anywhere from $25 to $40 a month, or you can add several riders on a hospital indemnity plan that makes it you can add cancer coverage or cancer benefits to a hospital indemnity plan, or ambulance riders to pay for an ambulance, emergency ambulance ride, and all of so they can be more expensive, but it's almost a necessity these days to when you're selling a Medicare Advantage plan to also make sure that your clients have a little bit of extra coverage with a hospital indemnity plan to protect them against some of those high out-of-pocket costs.
I agree, definitely. I don't think there's any other questions that have come through.
I don't see any either, and so we thank everybody for joining us this afternoon. Please feel free to reach out to us with any questions. We do record the presentation and be glad to share that with you. So if you'd like to see the recording, reach out to your specialist that you work with, and we'll be sure to help you out. So thank you, Kristen, and thank you everybody for joining us this afternoon.
Thanks, everyone, and I wish everyone a happy 2021. Thank you.